Hey everyone, welcome back to Speak Healthy. Today, we're going to discuss 6 diabetes myths that you shouldn't believe, as well as the facts that invalidate them. Diabetes is a chronic disease that affects millions of people worldwide. Despite its prevalence, there are still many myths and misconceptions surrounding the disease. These myths can lead to misunderstandings about the causes and management of diabetes, and can even prevent people from seeking proper treatment. In this video, we will debunk 6 common diabetes myths and provide accurate information to help you better understand this complex disease. Whether you have diabetes or know someone who does, it's important to separate fact from fiction to make informed decisions about your health. So, let's dive in and set the record straight on these 6 diabetes myths. Myth number 1. Eating too much sugar causes diabetes. Myth number 1 about diabetes, which claims that consuming too much sugar causes the disease, has been a widely held belief for a long time. However, scientific research has proven this myth to be false. While it is true that consuming sugary foods and drinks in excess can lead to weight gain and obesity, which are risk factors for diabetes, it is not the direct cause of the disease. Type 1 diabetes is an autoimmune disease that occurs when the immune system attacks and destroys insulin-producing cells in the pancreas. Genetics plays a significant role in the development of type 1 diabetes. While environmental factors such as viruses and toxins may trigger the onset of the disease, sugar consumption is not a factor. Type 2 diabetes, on the other hand, is a metabolic disorder that occurs when the body becomes resistant to insulin or does not produce enough insulin to regulate blood sugar levels. Lifestyle factors such as poor diet, lack of exercise, and obesity are major risk factors for type 2 diabetes. High sugar consumption can lead to weight gain, which in turn increases the risk of developing type 2 diabetes. However, it is not the sole cause of the disease. Myth number 2. People with diabetes can't eat carbohydrates. Myth number 2 about diabetes is that people with the disease can't eat carbohydrates. This is a common misconception that can lead to a lot of confusion and unnecessary dietary restrictions. In fact, carbohydrates are an essential part of a healthy diet and should be included in a diabetes meal plan. Carbohydrates are one of the 3 macronutrients, along with protein and fat, that provide the body with energy. They are found in a wide range of foods, including fruits, vegetables, grains, beans, and dairy products. While carbohydrates are an important part of a healthy diet, not all carbohydrates are created equal. The key to including carbohydrates in a diabetes meal plan is to choose healthy carbohydrates that are rich in nutrients and fiber. Whole grains, fruits, and vegetables are excellent sources of healthy carbohydrates that provide essential vitamins, minerals, and fiber. Foods that are high in added sugars, such as candy, soda, and baked goods, should be limited or avoided. It's important to eat carbohydrates in moderation and to balance them with other macronutrients such as protein and fat. Eating a balanced meal that includes healthy carbohydrates, lean protein, and healthy fats can help regulate blood sugar levels and prevent spikes and crashes. Myth number 3. Insulin cures diabetes. Myth number 3 about diabetes is that insulin is a cure for the disease. While insulin is an essential treatment for people with type 1 diabetes, it is not a cure. Type 1 diabetes is a chronic autoimmune disease that occurs when the immune system attacks and destroys insulin-producing cells in the pancreas. Without insulin, the body cannot properly regulate blood sugar levels, which can lead to serious complications such as blindness, kidney failure, and heart disease. Insulin therapy is a crucial part of managing type 1 diabetes as it helps to regulate blood sugar levels and prevent complications. However, insulin therapy does not cure the disease. People with type 1 diabetes must take insulin for the rest of their lives, as there is currently no cure for the disease. Type 2 diabetes, on the other hand, can sometimes be managed with diet and exercise, but often requires medication in addition to lifestyle changes. While insulin therapy may be used in some cases of type 2 diabetes, it is not always necessary. Type 2 diabetes is a metabolic disorder that occurs when the body becomes resistant to insulin or does not produce enough insulin to regulate blood sugar levels. Lifestyle changes such as healthy eating, regular exercise, and weight loss can help manage type 2 diabetes, but medication may be needed to achieve optimal blood sugar control. Myth number 4. Diabetes is a minor disease. Myth number 4 about diabetes is that it is a minor disease. In reality, diabetes is a serious chronic disease that affects millions of people worldwide. Diabetes is characterized by high levels of glucose or sugar in the blood, which can cause a wide range of complications if left uncontrolled. One of the most serious complications of diabetes is heart disease. People with diabetes are at increased risk of developing heart disease, which can lead to heart attacks, stroke, and other cardiovascular problems. Diabetes can also cause damage to the kidneys, leading to kidney failure and the need for dialysis or a kidney transplant. In addition, diabetes can cause damage to the eyes, leading to blindness or vision loss. Managing diabetes carefully is crucial to prevent these complications. This includes monitoring blood sugar levels regularly, taking medications as prescribed, eating a healthy diet, getting regular exercise, and managing other health conditions such as high blood pressure and high cholesterol. In some cases, insulin therapy may be needed to control blood sugar levels and prevent complications. It's important to take diabetes seriously and work with a healthcare provider to develop a personalized treatment plan that meets your individual needs. With proper management, many people with diabetes are able to live a long, healthy life without experiencing serious complications. Myth number 5. Diabetes is contagious. Myth number 5 about diabetes is that it is contagious. In reality, diabetes is not contagious and cannot be transmitted from one person to another like a cold or the flu. Diabetes is a non-communicable disease, which means that it cannot be spread from person to person. Diabetes is caused by a combination of genetic and lifestyle factors such as obesity and physical inactivity. While certain lifestyle factors can increase your risk of developing diabetes, such as a poor diet or lack of exercise, these factors do not make the disease contagious. It's important to understand that diabetes is not a result of personal choice or a lack of willpower. People with diabetes may need to make significant lifestyle changes to manage their condition, but these changes are not always easy to make. Diabetes is a complex disease that requires careful management, and people with diabetes need support and understanding from their friends, family, and healthcare providers. Myth number 6. People with diabetes can't eat sweets. Myth number 6 about diabetes is that people with diabetes can't eat sweets. In reality, people with diabetes can enjoy sweets in moderation as part of a balanced diet. However, it is important to monitor blood sugar levels and adjust insulin doses accordingly to maintain good control. While consuming too much sugar can increase blood sugar levels and make it harder to manage diabetes, it is still impossible to include sweets in a diabetes meal plan. The key is to eat them in moderation and in combination with other healthy foods such as protein and fiber-rich options to help slow down the absorption of sugar into the bloodstream. In addition, it's important to choose sweets wisely. Opt for treats that are low in sugar and higher in fiber, such as fresh fruit or sugar-free desserts. It's also important to pay attention to portion sizes and avoid consuming large amounts of sweets all at once. Managing diabetes effectively requires careful planning and monitoring. This includes monitoring blood sugar levels regularly, taking medications as prescribed, eating a healthy diet, and getting regular exercise. By working with a healthcare provider and following a personalized treatment plan, people with diabetes can enjoy a wide variety of foods, including sweets, in moderation. As you've learned, there are many myths surrounding diabetes that can lead to confusion and misinformation. While some of these myths may contain elements of truth, they are often oversimplified or misinterpreted, which can lead to misunderstandings about the disease. By understanding the facts about diabetes, we can help to dispel these myths and promote accurate information. Diabetes is a serious chronic disease that requires careful management to prevent complications. However, with the right tools and resources, people with diabetes can lead happy, healthy lives. This includes monitoring blood sugar levels regularly, taking medications as prescribed, eating a healthy diet, and getting regular exercise. By working with a healthcare provider and following a personalized treatment plan, people with diabetes can manage their condition effectively and enjoy a wide variety of foods, including sweets, in moderation. It's important to support and understand people with diabetes and to work together to promote accurate information and dispel myths about the disease. By raising awareness and promoting education, we can help to ensure that people with diabetes receive the care and support they need to live full and healthy lives.